Have you ever caught yourself thinking, maybe I'm just getting older? Maybe you've become more forgetful, more tired, less motivated. Maybe words don't come as quickly as they used to. Perhaps you wake up feeling exhausted even after sleeping all night. And like many people over 50, you've probably told yourself the same thing millions of others say. Well, I guess this is just part of aging. But what if some of these changes are not simply normal aging? What if your body and brain have been trying to tell you something important? Because while aging naturally brings certain changes, many symptoms that people dismiss as getting old are actually warning signs that deserve attention. Today we'll explore several symptoms that are commonly blamed on age but often have deeper explanations. And understanding the difference may help you protect your health, your memory, and your quality of life. Constant brain fog isn't always normal. Everyone forgets things occasionally. You walk into a room and forget why. You misplace your keys. You struggle to remember a name. Those things happen to people of all ages. But persistent brain fog is different. If you regularly feel mentally slow, if concentrating feels harder than it used to, if your thoughts seem cloudy or your mind feels disconnected, don't assume it's simply because you're over 50. Brain fog can result from poor sleep quality, chronic stress, vitamin deficiencies, blood sugar problems, medication side effects, thyroid disorders, inflammation, depression. Many people spend years believing their brain is wearing out, when the real issue may be treatable. Your brain wasn't designed to feel cloudy every day. Extreme fatigue is not just getting older. Many adults over 50 say, I just don't have the energy I used to. Some slowing down is expected, but constantly feeling exhausted, needing naps every day, struggling to make it through normal activities, that's different. Persistent fatigue may signal sleep apnea, iron deficiency, heart problems, diabetes, hormonal changes, chronic inflammation, depression. Unfortunately, many people normalize exhaustion. They think, I'm getting old, but age itself doesn't automatically drain your energy. In fact, many people in their 70s remain active, energetic, and mentally sharp. Feeling tired all the time is something worth investigating, not something to simply accept. Memory problems are often blamed on age. One of the greatest fears people have after 50 is losing their memory. And yes, occasional forgetfulness becomes more common with age. But there is a difference between normal memory changes and concerning symptoms. Normal aging might mean taking longer to remember a name, forgetting why you entered a room, misplacing reading glasses. But warning signs include repeating the same questions frequently, getting lost in familiar places, difficulty following conversations, trouble managing bills or medications, forgetting important appointments repeatedly. Memory problems can also be caused by vitamin B12 deficiency, depression, sleep disorders, medication interactions, anxiety, hearing loss. Sometimes the brain isn't failing. Sometimes it's exhausted, stressed, or lacking nutrients. That's why changes in memory should never be ignored. Losing interest in life isn't part of aging. Many older adults quietly withdraw. They stop enjoying hobbies. They lose motivation. They avoid social activities. And they assume this is just what happens when you get older. But losing interest in life is not a normal part of aging. It may be a sign of depression. Depression in older adults often looks different. Instead of sadness, people may experience low energy, irritability, poor concentration, sleep problems, lack of enthusiasm, feeling emotionally numb. And because these symptoms develop slowly, many people don't recognize them. They simply believe they've become old and tired. But emotional health matters just as much as physical health. Growing older should not mean losing your joy. Poor sleep shouldn't be ignored. Many people over 50 accept poor sleep as inevitable. They say, I wake up several times a night. I never feel rested. I sleep, but I still wake up exhausted. Although sleep patterns change with age, chronic poor sleep isn't something you should simply tolerate. Sleep disorders become more common with age, including sleep apnea, restless legs syndrome, insomnia, Anxiety-related sleep disturbances. Poor sleep affects nearly every part of the body. It impacts memory, mood, blood pressure, blood sugar, immune function, brain health, and over time, poor sleep may worsen brain fog and cognitive decline. Your body repairs itself during sleep. If sleep is broken, healing becomes harder. Balance problems aren't always old age. Feeling unsteady? Becoming afraid of falling? Losing confidence while walking? Many people assume balance problems are unavoidable after 50. But balance depends on several systems working together: vision, inner ear function, muscles, joints, brain signals. Problems in any of these areas can create instability. Sometimes balance issues are caused by medication side effects, vitamin deficiencies, hearing problems, diabetes-related nerve damage, low blood pressure. Falls are one of the leading causes of injury among older adults. So don't dismiss balance changes as just aging. Small changes deserve attention before they become serious problems. Frequent mood changes are not normal aging. Do you feel more anxious lately? More irritable? More emotionally sensitive? Many adults blame hormones or age, but sudden emotional changes deserve attention. Physical conditions affecting mood include thyroid disorders, blood sugar fluctuations, chronic inflammation, sleep deprivation, nutritional deficiencies. Mental health conditions such as anxiety and depression are also common but often overlooked. Remember, the brain and body are deeply connected. Sometimes mood changes are not personality changes. They're health changes, and health changes can often be addressed. Shortness of breath should never be ignored. Many people say, "I'm older now." Of course, climbing stairs is harder, but becoming unusually breathless during normal activities isn't always a normal part of aging. Shortness of breath can be linked to heart disease, lung conditions, anemia, sleep apnea, poor physical conditioning. The body naturally slows down over time. But severe limitations are different. If ordinary tasks suddenly feel harder, it's worth paying attention, because your body may be sending important signals. Hearing loss can affect more than your ears. Hearing changes are common with age, but untreated hearing loss does more than make conversations difficult. It can contribute to isolation, depression, brain fatigue, memory difficulties, increased cognitive decline risk. Many people avoid hearing tests because they believe hearing loss is just part of getting older. But hearing connects us to the world, and preserving hearing may help preserve cognitive health as well. Staying socially engaged keeps the brain active. Isolation, on the other hand, can quietly accelerate decline. Feeling weak is not something you should accept. Muscle loss naturally occurs with age, but significant weakness is not inevitable. Many adults become less active after retirement. They move less. They sit more. And over time, muscles weaken rapidly. But weakness can also result from poor nutrition, vitamin deficiencies, hormonal changes, chronic disease, inactivity. Strength matters more than many people realize. Strong muscles support balance, mobility, independence, brain health, longevity. It's never too late to improve strength. Research consistently shows that people in their 60s, 70s, and even 80s can build muscle and regain function. Aging does not mean giving up. Why so many symptoms get dismissed? Perhaps the biggest problem is this: people expect decline. Society teaches us that suffering is simply part of aging. So symptoms get ignored. Fatigue becomes normal. Brain fog becomes normal. Poor sleep becomes normal. Memory problems become normal. Loss of joy becomes normal. But many of these changes have underlying causes, and many are treatable. The earlier they're recognized, the better. Aging is normal, suffering isn't. Growing older is a privilege, and aging naturally brings change. But aging does not mean you should stop feeling alive. It doesn't mean constant exhaustion. It doesn't mean accepting brain fog every day. It doesn't mean giving up your independence. And it certainly doesn't mean ignoring symptoms that your body is trying to communicate. Your body changes with age, but it still speaks, and it deserves to be heard. If you've been telling yourself it's probably just old age, pause for a moment, because some symptoms are normal, but many are not. Persistent fatigue, brain fog, poor sleep, memory changes, loss of motivation, balance problems, mood changes. These are not things you should automatically dismiss. Pay attention. Ask questions. Talk with your healthcare provider, because sometimes what looks like aging is actually your body asking for help, and recognizing that difference may be one of the most important things you do for your future health.
Before we conclude, a quick reminder. The information shared in this video is for educational and informational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this channel. Your health is your most valuable asset. Treat it with the professional care it deserves.